Good evening and welcome to Taylor Tuesday. I am joined by Ashley Watkins, who is Sales and Service Representative, and my name is Carla Ross, and I'm the COO for Taylor Medical. And we'll introduce our speaker in just a moment. We'd like to remind you that our webinar series is available. If you missed any, it is free. All you need to do is go over to our website. That's www.taylormedical.com and go to where it says webinars. So we hope that you'll take advantage of that and go over and see what you missed. One of the questions we get most is, how do I make sure that I take full advantage of the savings that Taylor brings to the table, or my Taylor membership brings to the table? And there's no better way than to allow the Taylor team to do a free cost analysis for you. And then all we need is your ordering history. You can send it to admin@taylormedical.com. We have on our website the directions for how to download your Henry Schein or your McKesson. And if you don't have access to online, if you don't order online, you can simply send us some recent invoices and we can certainly work off that. The items that are really important is that we have the current vendor, the item description, the SKU number, the unit of measure, and the price. We want to make sure that we give you an apples to apples as well as an apple to orange cost analysis. So we hope you'll take advantage of that. Again, no cost at all. And we'll show you the savings that your Taylor membership affords you. At this time, I'd like to introduce our speaker, Rob Lowenkoff, who is National Sales Consultant of Demand Force. For the past 6 years, he has worked directly with DPMs and office staff to improve patient engagement, marketing, and office efficiency by helping podiatry practices implement mobile communications, streamlining workflow. Over the last year, they've innovated new tools to help practices recover from COVID-19, increase patient volume and retention while maintaining safe procedures for staff and patients. I'm going to let you take it away, Rob.
Thank you so much, Carla, and thank you guys so much for the introduction. I really appreciate both of you as well as everybody at the Taylor Medical team for having us participate in Taylor Tuesdays. There's obviously been a lot of great content throughout these series, so very excited to have the opportunity to speak to you guys, whether you're already using Demand Force or you've heard of us, or maybe this is the first time you're hearing about our program. This will be a really great opportunity to let you know what we're all about. Some of the biggest value points that Demand Force offers for our DPMs. And then more importantly, the biggest thing that we're talking about right now is what we've been doing to help practices recover in the time of COVID. So just to give you a little bit of background, for about 17 years now, Demand Force has been the leader in streamlining mobile communications and marketing and patient retention and acquisition for medical practices in general. So a lot of the things that we were known for in the beginning was just implementing mobile communications, starting to utilize things like email, text, even automated phone calls and postcards for patients. So I mean, back in the day, that was very simple, everyday stuff like reminders and confirmations. As our program has evolved and our offices have evolved with the times, that's become more focused on retaining patients, making sure that patients with certain conditions are coming back as often as they need to, people aren't slipping through the cracks, and then that we're also adapting to the internet age and realizing that medical offices and podiatrists all across the board have just as much of an important role to play in online presence as anywhere else that your patients are going. So over the last year, I would say I've never seen this product have so many innovations and adapt to change so well, because it's been a struggle through the different phases of COVID, whether it was letting patients know that we're still open and that these are essential services that are keeping people out of the ER. And now we're in the phase where we're used to practices being open. People have become more accustomed to safety precautions. So what are we doing to make sure that we're maximizing the amount of patients that we can see in an office while making sure everybody is safe from your staff and from your patients. So those are the topics that I want to cover here, kind of divided up into a couple different categories here. And again, whether you're using Demandforce already or you're just getting used to the basics here, we'll make sure that we can let you know what's new that we've been working on and what the standard's always been. So the first category we'll talk about here is the targeted communications. One thing that's very unique about Demandforce and how it communicates with patients is that our system is integrated directly into your EHR or your practice management system. So whether you guys are using something like TrackNet or a different EHR, Demandforce can sync up with that program, read the schedule, read your patient database so we know who they are and all their demographics, and send targeted communications. So it's a lot more than just a blast type system. It's very targeted, very tailored communications so that patients are as engaged as possible and you're getting the right message to the right people. So that's a big core competency of the program, is that integration. Now, in addition to communicating with existing patients, a big part of this has been doing what we can to acquire new ones. So even if a majority of your patients are referrals from a PCP or finding you in different ways, the online presence for podiatrists has become more important than ever, especially in the time of COVID. Not just that the reputation is positive and that it's real easy to have a ton of great reviews from patients, but making sure that information across not just your website, but social media and Google are accurate so that patients can easily access the practice and have updated information. And then last but not least, we'll dive into saving the best for last, some of the biggest innovations that we've made over the last year in light of the pandemic, and predominantly our mobile check-in feature. So like I said, we've always really been big on communicating with patients digitally, mobilely, with email, with text, and now we've been able to redirect and create new tools to make sure that we can maximize the amount of patients you're seeing, but they can check in mobilely, they can stay social distant, be contact-free, be paperless by checking into appointments from their car, relieving time in the waiting room, and even doing forms on their phone. So that's the last part we'll get to, is some of the brand new tools that we've come out in light of everything that's happened. So the first category, targeted communications. This has really been our core for a majority of the time, and it's certainly evolved. Right, so whether it's just targeted communications in the sense that we're sending someone a reminder for their appointment through an email or a text. We know when their appointment is, we can make it easy for them to receive that and then interact with the staff by confirming or even having a two-way text conversation with the patient. Some of the more developed, newer ways that we have offered this is in regards to email campaigns. Obviously, emails not as popular as text and not as accessible, especially when you're dealing with podiatry and an older patient base. However, email is becoming more and more popular again as it's become more mobile. There's so much more information you can put in an email than a text. So there's a huge opportunity there. And then, of course, expanding the reach with text message, always going to be the fastest, easiest way to get a hold of someone. Triggering reminders to inactive and past due patients. This has always been important, but it has a whole different meaning now. We're not just talking about patients who are a little overdue. We're talking about people that have slipped through the cracks in 2020 because they didn't know if they could come in, they didn't know if they should leave the house, and these are people that we really need to target. And then there's a number of other automated messages that we can use for different purposes that we'll be able to dive in here a bit as well. So using targeted email campaigns in segmentation to reach patients. I'm sure many of you at this point have perhaps experimented with different ways to send an email campaign, whether for marketing or just general health information. And it can be a fine line and a slippery slope. Do you want to take the email addresses of every single patient in your database and blast them a message? Well, sometimes maybe for something like Happy Holidays or global pandemic, that might be relevant. But the fact is, you're walking that fine line between spam and valuable information that patients will feel compelled to be engaged with. So looking at some of the stats on here, just in terms of how much this contributes to revenue, I mean, those are on your screen here, but the way that we differentiate this is by targeting and segmenting. And this is one of those key components of being integrated with the practice management system becomes so important. Rather than just blasting an email to everyone in the database, we can look at demographics in your EHR. So maybe you want to send a targeted message based on their age, based on their gender, if something's going to be more relevant. All of that information is generally in the practice management system. Their insurance type, the procedure codes, CPT codes, diagnosis codes, their provider, which provider they belong to, their location. So what we can use and how we can use email communications effectively is by targeting using all of these different segmenting options. If you only have a limited number of time slots available, maybe you want to look at things like insurance type, right? If you want to have a special type of recall or marketing campaign or retention campaign just for diabetic patients who need to come back more frequently, you know, that's not necessarily information that everybody needs to have. So it really makes the difference between why am I getting this weekly newsletter to, oh, my doctor just sent me some critical information, I probably want to engage with this. So really want to emphasize that's really the difference between sending somebody a newsletter, sending someone spam, but then using the information that you have about your patients through an integration like Demandforce to send something targeted. And that's ultimately what you're going to see a response to and is going to equate to more appointment requests. So I'll kind of mention that as well. It's not really in the slide here, but one of the reasons our retention or our marketing campaigns can be so effective is because we do allow patients to respond to the messages and to request appointments. So keep that in mind. I can already see there's some activity in the chat. Thank you guys so much. I'll say this, if you have any questions, any point in these slides, feel free to throw it in the chat and we'll get to it when I reach the end of the slide. So I promise I'm not ignoring you. We will definitely have the opportunity to address any questions that you have. So again, back to these targeted campaigns, it doesn't just have to be recall. So it can be promotions. I know a lot of the times we're not generally really heavy in the marketing, but I have had a lot of my DPMs tell me that they've paid for this program multiple times over by increasing the amount of orthotics or inserts or shoes that we're able to help cover. Letting patients know that your insurance will cover X amount of products over the next year. So we can keep track based on what's in the EHR, what their diagnosis is, what type of insurance they have, and what they have and have not purchased. So again, we're not just sending something to everybody. We can have it targeted so the right people are getting those messages. Seasonal and educational content. I meant, very popular for things like year-end insurance campaigns, holidays. Those were just definitely really big ones. Over the pandemic, the use of our email campaigns went up 800%. So we were really, all hands on deck in terms of supporting our Demandforce users who needed to just get the word out. A lot of the times a simple text blast, which we can also do, can be a great way to, we're open, we're social distancing, we're, whatever information you need to get out there. This has been a very different year in terms of patients expecting to have easy communication with their providers and not looking at it as spam. So targeting patients by the demographics, appointment types, service types, and more, those are really the key difference here for making these effective communications. So text messaging. No doubt it's the fastest, easiest way to get a hold of people, and it is generally the preference. So even in demographics and cities where email is more popular and patients are more receptive, generally you're going to see somewhere around 70%, if not more, of patients prefer text as their primary method of communication, which is fine. It's direct, it's immediate. A couple different things we can do with text or email. So we're talking about appointment reminders, appointment patient recall. We haven't seen you in 7 months, time to come back in. Or we haven't seen you in 2 years. We want to make sure you're okay. We know when their last appointment is, so we can do that. We also have the two-way text capability. So if a patient responds to a reminder and they say confirm, we can mark that confirm. But if they ask a question, or if they have a problem with their appointment, or they're running late, we actually give you the ability to text back and forth with your patient. So more information can be put into an email for obvious reasons, but text is a very immediate and two-way interface. So different things we can do, the mobile check-in procedures, which we'll talk about, updated office hours. Are you guys still open? You know, we pretty much know that at this point, but what kind of changes have been made? How many appointments can we see in a day? Last minute openings if we want to squeeze people in, and we do have wait list features as well. Trigger reminders to inactive and past due patients. I'd say a majority of the offices that we work with, up until they use demand force, when we talk about recall and inactive patients, they're running a report in the EHR. Here's a list of all the patients that are overdue, that we haven't seen in 6 months or 12 months, start calling them. And, you know, some office staff can manage to do that, but for the most part, it's very time consuming. Not very direct, not very effective. It's usually we'll just get to the ones that we can, and they generally report leaving voicemails 80% of the time. So this way, the staff isn't going to have to be on the phone. You know that it's just, I can send 1,000 texts out faster than you can make one phone call, right? I mean, obviously we don't want to overdo it, but it's just much more efficient. You know your patients are being engaged. They can text back and forth with the staff, and they can even reschedule appointments if they miss. So it's a very effective way to have that immediate result. So automated series of educational messages, pretty much along the lines of what we were talking about with the email campaigns. It doesn't just have to be marketing or come back in to see us. People have really wanted answers over the last years, you know, about what they need to be worried about, what aspects of their health they need to take care of, any updates. So we can make sure, we call them drip educational campaigns. Maybe if you're a new patient, I want you to receive this information. Then a couple weeks later, I want you to see this different information. So making sure that you're keeping patients engaged in addition to just your regular day-to-day communications. Online reputation. So definitely been more on our minds over the last 5 to 10 years. Originally, back in the day, when we thought of Google reviews, it was pretty much just restaurants and hotels, but that game has completely changed. It's pretty much anywhere you're going to go as a consumer or a patient. You want to know that they have a Google page. You want to know that people are saying positive things, and it's a really quick way to get information. Are you open? Have the hours changed? If I'm going to drive to your practice, guess which app I'm going to use to get there? The same Google page where all your reviews are. So, I mean, these in many cases are more important than a lot of the other listings you might have online. So, improving your star rating. A lot of practices will have success just verbally asking people to leave reviews. You'd be surprised. There's a lot of studies that say most consumers are willing to leave feedback at all for a business or a medical office that they go to, but a lot of them just aren't going to go very far out of their way to do it unless they had a horrible experience or they just simply do not know how. So the same way we can do reminders and recall, we can follow up automatically after appointments with text, with emails, and prompt those patients to go to a number of different sites depending on what your focus is at that time. So are you focused on Google, Facebook, Yelp, WebMD, Health Grades? I mean, there's so many review sites just dedicated to the medical space, so we can make sure that those are being received. Review alerts. You want to know what those messages are, so we'll let you know. Are you getting good reviews? Are you getting bad reviews? Do you need to respond to them? And then last but not least, review syndication. A lot of the times I might see 600 Google reviews, 4.8 stars, and then 2 one-star Yelp reviews. So making sure that it's consistent across all those. Enhancing your social media presence. Now, do podiatrists need to post on Instagram every day? Debatable. I think a lot of people are embracing these methods of social media more. In my personal opinion, I think it's a great idea. Why not? It's not going to take a lot of time or cost anything, and it's going to overall contribute to your SEO. One thing that we're starting to see is same thing with Taylor Tuesday YouTube channels. Post content, get it out there. Make it easy for Google to connect the dots. So this has always been becoming more and more important, but now more than ever, if your hours aren't being updated on Facebook and Google, and your website, and it's a pandemic, and I'm not sure who's available and what time I should go and should I even call. I mean, I'm sure most of us has experienced this with doing our takeout dining throughout 2020, and you're not getting a clear message. It's such an easy way, even as a healthcare provider, to update that information to make sure that you're just getting as accurate information to patients as possible, whether they're existing patients or, even more importantly, if they're new patients who are just kind of checking you out because they've been referred over. So again, doesn't take a lot of time. Social media is out there. It's free. It's a quick, easy way to solidify that presence. Taking control of how you appear online. I think I kind of beat myself to the punch on this one, but making sure that the information is accurate. The name of the business matches the name of the business on this other profile. The address is accurate with the suite number. You know, if there's been a doctor change. I mean, this stuff is easily overlooked, but it's usually easily fixed, and it can have a monumental impact on your overall online reputation. So these are tools that we help with, in addition to just, I'll go back here before we get into that, in addition to just generating feedback online in the form of online reviews or following up with surveys after appointments, which we also do, and then converting that into a review or converting that into a referral from another patient. A big part of what we do is work with you and your staff to ensure that all of this information is accurate online and that we're communicating it effectively to patients. Important safety measures. All right, now we're getting to the really fun and new stuff. We've definitely made a lot of leaps and bounds in regards to online presence management, the way we get reviews, and hopefully if I do get the opportunity to have one-on-ones with you and demos after this, we can go a little bit deeper into how we're able to do that now. But I'd say the biggest features that we've innovated and that we've released over the last year have been everything having to do with mobile check-in, online forms, making it very easy for you to see as many patients as possible while protecting your staff and protecting the patients as well, making sure that everybody feels comfortable coming in. So the first one is the mobile check-in, making it so patients can just check into their appointments on their phones, let you know when they've arrived without waiting inside the waiting room, and digital intake forms. So no more paper, no more pens, no more iPads, no more contacts, doing it all on your phone. So let's dive into these a little bit. Okay, so the mobile check-in effectively reduces the amount of time patients need to spend in the waiting room. There's been a lot of different ways to do this. We're just going to take some chairs out of the waiting room. We're going to get rid of the magazines. We're going to put hand sanitizer everywhere. Can certainly be a good way to do it. I know a lot of us have also kind of turned our parking lots into waiting rooms. So pull up, call the number. We'll let you know when it's safe to come in. So whichever one you're doing, the goal here is obviously not to reduce the patient volume any more than we need to, not to reduce the revenue any more than we need to. So now what we can do, in addition to the reminder or confirmation, we can, when a patient arrives or shortly before their appointment, receive a text that allows them to check in and say, hello, I'm here, I've arrived. And then we'll walk them through a series of questions and pages that they can complete, which you get to customize. The first one is a COVID-19 screening form. Have you been experiencing symptoms? Have you come into contact with anybody who's tested positive for COVID-19? Pretty basic stuff that all of us have been asked at some point or another before entering a business. So making sure that anybody who has come into contact or is having symptoms is figured out before they come in. Limiting the use to touch surfaces, pens, and clipboards. So yeah, clipboards, pens, iPads, paper. In addition to the COVID screening form, we can include intake forms, release forms. Basically, we have an entire form builder. So if there's a form that you like that you guys normally use, you can essentially recreate that into our program and include any fields that you want. Everything from name, emergency contact, health history, insurance, and we can even have them do e-signatures. They can sign the form digitally on their phone and then the staff will receive the completed form as a PDF. So this has been a really big one. I think we all knew eventually that mobile forms was going to come through the pipes. I think this pandemic just pushed it forward a little bit quicker here. And it's going to let them know that they can come safely. I think, you know, any business we've engaged with, or medical office or restaurant over the last year, we know pretty quickly how comfortable we are with their process, and that's going to severely impact whether or not we come back. So, I mean, these are very important tools here. So the digital intake forms, here's some of the examples, and this is what the icons look like in the program before you edit them. So we have your COVID-19 screening, prescription refill, insurance, custom form, new intake form. You can just completely create these from scratch, just using the customizable fields, where you can just build these together and then include that into the check-in process. Obviously, paper-free, contact-free, and it's all completely secure and HIPAA compliant as well. All right, so those are the main things that I wanted to go over with you guys. Just to sort of recap, we have the basic, well, I don't want to say basic, but the core competencies that DemandForce has always offered in terms of patient engagement. So your email, text, mobile communications designed to save you time in the office, make sure the staff has a very streamlined way of communicating with patients, and retention. That's probably the biggest reason podiatrists use DemandForce, in my experience. They usually end up using a majority of the tools that we have available, but the biggest one is generally by far rescheduling missed appointments, recalling diabetic patients that are overdue for their appointment, and making sure they know when their next appointment is. So get off the phone, stop running reports, just do that through email and text. And then online reputation, I would say 5 or 10 years ago, it's kind of gone through the different medical industries. It was already important. You mostly saw it with your dentist and your optometrist, and then ultimately your urgent cares. But now it's every single medical industry. You got to have a good Google presence, update the address, get a picture in there, and let us help you get tons of reviews and ensure the information is accurate. And then last but not least, these tools that we've released specifically in light of the pandemic. So making it easy to stay safe, social distant, mobily check in, wait in your car. Once the forms are done, notify the practice that you're ready. You can just text them, hey, good to go, put your mask on, come on in. So we're very excited to be teaming up with Taylor here and offering an easy way for all of you to take advantage of DemandForce and see this thing in action. So hopefully I will have the opportunity, whether you're already using DemandForce and you need a little bit more, help or some success stories or advice on how to launch some of these new tools, we're available to you. Or if this is going to be the first time you've implemented DemandForce, we want to make it real easy for you to get started. So normally we'll charge setup fees to customize the program and go through our onboarding process. And we're completely waiving the setup fees for our Taylor Medical participants. And we will also comp you for the first month of service. So it's a very quick and easy process. It takes usually about 15 minutes to integrate into your EHR, and then about an hour and a half to customize the program, and then we are live. So get it up and running, see how it works. You'll know in the first couple weeks. And very excited to be able to offer this to our Taylor family, and can't thank you guys enough for allowing us to participate and offer this as well. So hopefully I'll be working with you guys one-on-one. I'm going to go into the chat here, I think, and I'm going to leave my info up here on the screen so you can call me or send me an email if you want to get in touch with me directly. I'm going to click into the chat here and see what kind of questions. So do you guys mind if I just kind of start going at these questions in here, or did you want to add anything?
Can I say something?
Please. Good to see you.
So I'm normally the host here, but I got a little laryngitis, but I just really needed to jump in, and I wanted to let you know that DemandForce has been something that I utilized in my practice way before we even envisioned creating Taylor Medical. So I can surely tell you that DemandForce is something that helped me build my practice and communicate with my patients. And I have not looked at some of the new material, but all of the different tools that Rob has just shown that are available are significantly different even when I started using Demand Force. I want to say back in 2006, 2007. So it's been quite some time, but I just wanted to break my silence. I promised I wasn't going to talk, but I just couldn't keep quiet. And then I'm going to turn it over and let you guys answer questions and handle everything. But it's definitely something worthwhile looking into, everybody.
All right, I really appreciate you chiming in with that. I'm really happy to hear that you've had such a positive experience and that you're able to help share that. So thank you, Iris, so much for letting me know that. I really appreciate you chiming in. That's great to know. Awesome. Okay, let's see. I do have some questions in here, and then I have some frequently asked questions that I can dive into. Contact information, easy, right there. Easiest question ever. So Rob Lowenkoff, there's my phone number, there's my email address. Please don't hesitate. Whether you need any kind of assistance or insight into your existing account, I'm more than happy to help you. Sounds great, but what kind of pricing? So generally speaking, our list pricing is going to be $299 a month per location, which is great because it's as many users as you want, as many providers as you want. It's a flat rate. You can send as many communications. We do have some variants to the monthly pricing structure based on the length of the agreement. So that's something I can always work with you as well. And then, of course, keep in mind with Taylor, you do get to use the program completely for a month as well to decide if it's something you want to continue with. But generally speaking, that should pay for itself pretty quickly. Let's see here. All right, I have some frequently asked questions that we often get. And I know I went back and forth a little bit on, are we sending emails? Are we sending texts? How do we decide who's going to be receiving what? And the answer is ultimately you, when you set up the program, you get to decide what's going to be an email and what's going to be a text. But really, your patients have the ability to select that for themselves. Patient preference is everything. A lot of the times I'll talk to doctors and it's like, yeah, but I don't really like emails. And it's like, well, your patients get to choose. So if they prefer email, if they prefer text, if they still like getting phone calls, we give them the ability to edit that themselves. So the preference is a big part of it. NextGen is our EMR. Very nice. Demand Force automatically integrated. Yes, we do integrate with NextGen. We've been working with NextGen for years and years and years. All of the features are available. And yeah, always happy to see a NextGen user using Demand Force. So we work with about 200 EHRs and management systems in the medical space. So there's a lot. Some of them I haven't heard of. Let's see, do we integrate with SAMI? I don't think so. That is not one that I've come up with, but I can definitely double check that and get back to you. But I don't think we have an integration with SAMI unless it has a different name that I'm more familiar with. Let's see. Do the forms integrate into the EMR or manual entry is still required? Great question. As of right now, you'll receive the completed form as a PDF. So if you want to transfer that information, it would need to be inputted manually. That's a really good question, though, because that is changing. That is something we're working on, and it's through the pipe. I'm expecting it sometime this year, but I couldn't give you a definite on that. In most cases, depending on the EHR, what we've been seeing is they're either manually inputting it into the system, or they're just attaching it to the patient record as a PDF, if that is allowed. But I know not every system can do that. Do we work with eClinicalWorks? Gosh, I know we've been working on that integration for a really long time, but I don't know if it's ready yet. I might be able to have an answer for that for you very quickly here. Let's see what we have. I don't think eClinicalWorks is ready yet, but we've been barking up that tree for a long time. From NextGen, we are not integrated with Demand Force. From my understanding, requires, yeah, pretty much they all require an API. I understand. I'm looking back. Okay, in regards to NextGen, is it automatically integrated? I'm sorry, I didn't completely understand your question. Yes, when we do sign up a NextGen user, it does require an API. Usually it's just a matter of getting onto the server, and it takes about 15 minutes to sync. So it's not pre-baked into NextGen. It does require an API, but that's pretty much true with all of our integrations, including our partners like at TrackNet, right? So it's usually just a matter of getting on your server in your practice after we've done the BAA and integrating it over the phone. If it's hosted by NextGen, we might need to contact NextGen, but again, 15-minute process. AdvancedMD, we do work with AdvancedMD. We're partners with AdvancedMD, actually. We like them a lot. They take care of us. we love it when we have mutual clients with them. So yeah, AdvancedMD is a big one that we work with, for sure. Great question. Let's see. Always fun to hear the next big thing.
Dan was saying that the ICF software is SAMI. Does that ring a bell to you?
Oh, no, I don't know that one then. I would have to get back. I can double check with our development team to see if that's one that's in the works, but I'm pretty familiar with most of the ones that we work with, and that one is not ringing a bell. So I apologize. We may not work with that one yet.
Okay, I'm going to kind of shift gears from different EMRs that you integrate with and ask you what can we do about a bad Google review? If an office gets a bad Google review, what are your suggestions on that?
Very good question. And a lot of the times when I'm talking to individual practices, they might have a couple different focuses. Either we have a lot of good reviews and we want more, or I have this one bad review out of 5 that's dragging my average down from some disgruntled person who's never even been to my practice. How do I get rid of it? And the fact is, unfortunately, just the way that Google works is you can't really. There's nothing, in only rare circumstances where there might be like, you know, a violation of sorts, Google, but the best thing we can do is A, prevent bad reviews from happening, and B, bury them. So let's say you have 1 bad review out of 2, that's going to drag your average down pretty far. But if you're seeing 100 patients a week, and then all of a sudden we just start burying it, it's going to get lost and you're going to be overwhelmingly positive. So a lot of the times, some of our practices might have 500 reviews and a handful of 1 stars, but you don't even see those because they're just buried. So that's the first thing we do, is we bury it with positivity. The second thing we do is we try to prevent them from happening. So one of our tools is the ability to collect internal feedback first, and then based on what that feedback is, decide, do we want to send this person to Google, or do we want to just do like an internal survey, right? So they have the opportunity to get their feedback out without the whole world needing to know about it. Great question.
Okay, and so let's say because of the pandemic, you've got just a slew of routine nail care patients that haven't come into the office because it's not really imperative that they come in. Is there a way to just target all the routine nail care patients that haven't been in and send out something mass to them to just get in? Maybe if you have what we used to do with Dr. Krause was Toenail Tuesday. And so, you know, to kind of fill your slots for Toenail Tuesday, is there a way to just hit that demographic?
Yes, absolutely. So there's a number of different ways we could do it depending on how we can denote those patients in the EHR. So the different ways that we are filtering, I think for something like that would be services received. So when you're doing the drop-down filters of who do I want to send this campaign to, I say only send this to patients who have received X service in the past, but hasn't been in Y amount of time and does not have an upcoming appointment. So we're making sure that we're only sending that to somebody who's applicable to the service, either based on their appointment history, or a procedure code in their history, or a diagnosis code, and then making sure that it's been a certain amount of time, so it's not like they got it yesterday and then they're getting this promotion, which is what happens a lot when you don't have targeted messages. People go, why am I getting this? And that they don't have one scheduled for 3 months, so that they're bothering the practice saying, why am I getting this? So there's different filters we can add to make sure that it's going to the right people and it's timely as well. So they go, oh, shoot, you're right. I do need to come back in. Let me just click here to request the appointment.
So is there one filter to choose, or can you choose several filters in trying to figure out who you're sending it to?
Several. In fact, you can change like the verbiage to the cadence. Like there's a drop down. It's like send to people who have or have not received the following services. So you could check multiple. So maybe you want to let them know about a service that they haven't received yet versus something that they've come into before. So you can select and deselect whether it's an appointment type, a service type, a product, or a procedure. So there's several ways to do it. And then there's different verbiage that you can add to either include or exclude these different processes.
Okay. And do you see Dr. Mark Lambert's question there? I don't know if that's pronounced, is it Cerner?
I don't know Cerner. I'm going to say no for that one. Do we work with Cerner? It's not one that I recognize. So I can double check on it, but I would say no for now.
Okay. And can Demand Force help you to sell product?
Yes, absolutely. So, and I know I get across the board answers to this when I'm talking to practices. Some practices are bigger on products than others, whether it's orthotics or inserts. But like I mentioned earlier on in the call, this can be, it can really be based off of an insurance type, and this can be a primary way that the program pays for itself. I don't know, I'm sure all of you listening have a much better idea than I do in terms of, you know, what the revenue is after insurance covers some of those products. But I mean, if we can let people know, hey, it's time for more inserts or for more shoes, I mean, that can be a huge way. The same way we filter the different services, we can look at what they've purchased in the past and what their insurance covers. Getting some push. Okay, so back to next gen. Okay, so that's something we could probably talk offline about in regards to next gen office. My understanding is there's next gen and then there's next gen office, formerly MediTouch. Sounds like maybe that's what you're referring to. And there has been some confusion. We work with next gen, but we don't work with next gen office, formerly MediTouch or Health Fusion, I think it's what it's called. I don't want to go too far down that rabbit hole right now, but we might be talking about two different systems. So I apologize if there's any confusion there, but we do work with next gen. So yeah, that's an interesting point. We can feel free to give me a call or shoot me an email and I can give you a little bit more detail, make sure that you are using one that we're working with.
Okay, and as for your forms that you can implement into the patient's chart, sure. Is that just your basic primary intake forms, or are we talking you could also integrate that and have them sign on their phone like a letter of medical necessity, for instance?
Yeah, I mean, in theory, it'll be easier if anyone wants to look further into the forms and I show you the demo. You basically have like a blank form and then you have all your different fields and you can custom fields. Is it a multiple choice field? Is it something the patient that can check in? So, I mean, if the basic ones that we include are name, insurance, health background, but yeah, for something like that, you can completely create a custom form. The only thing we can't really do is take like a paper form, upload it and digitize it. You would kind of have to recreate it. But I mean, there's limitless options in terms of the fields that you can customize.
Okay.
Great question.
I think that's all. Do you have any more frequently asked questions, Rob, that you can review?
You guys are really solid with the questions. I think we really did a lot of it. How do we target diabetic patients? I think we pretty much brought that up. We can look at a diagnosis code. So that's, you know, I'd say that's a really big crown jewel for DPMs, for our system, is everything that we just talked a lot about, filtering by the different appointment types, services received, CPT codes, diagnosis codes. But yeah, no, I think that pretty much covers it.
Okay, Dr. Kraus, do you have anything to add? We've come up a little early. Okay, so
I just sent in a question.
Oh.
Because I don't want to talk.
I'll read it. It's cool. I can see it.
But you see what I'm saying, Rob? I think that some of the services that Demand Force might provide are now covered in some of the EHRs, and people feel that they would be paying duplicative for duplicative services. So I didn't know if Demand Force is, you know, purchasable as a module, or is there a reduced fee if they don't want certain services? because I'm seeing that now with a lot of the other EMRs that
Sure.
some of them are coming out with some of the communication modules and the patient contact modules. And so I just was wondering if you've encountered that and what Demand Force's position is on that.
That's a really good question, and I'm really glad you brought that up because, yeah, this does come up frequently. So what's interesting is nowadays, pretty much every single EMR or practice management system has some form of like stock communications that come with the program. And if they haven't already, then they're coming out with that now. Now, they're generally very simple, very basic. I would say a majority, in most of our partners too, like, because they know that if the only thing your practice needs is a very simple like text reminder that goes out a day before, and that's all that you need, for some practices, depending on their volume and where they are, that might suffice. But the thing is, when it comes to things like recall and retaining patients and looking at these very, very specific characteristics and demographics that we can filter by and then do the marketing and getting reviews, there's not really an EHR that has all of that capability. So generally what happens is a practice will reach out to us because they really want to improve their online presence, or they really want to improve their retention, right? Like they're not necessarily looking for an appointment reminder, although some do. But what they end up finding is all of our features kind of tie into each other. So you wouldn't want to have one program sending out reminders and then another program sending out recall, because now you have two different programs communicating with your patients, which can overlap in not great ways. And with having it all in one system, we know, okay, we already sent them a reminder today. Let's wait a few hours before we send them something else. You can click on someone's name, see every single communication that's been sent out. I have come across where some practices, I use my EMR for reminders, I use this program for email blast, I use this one for retention, and it's a mess because there's no way to control whether or not people are being over communicated with. And then in addition to that, it's all a cycle. So our reminders lead to the appointment. If it's missed, that leads to the recall. If it's completed, that leads to the review. So you really want one system doing everything. But no, that's a really good point. But pretty much every EMR has a very basic, usually archaic version of reminders. Is Demand Force month to month or an annual contract? We generally, you'll have a different options. It's generally 12 months or 24 months. Luckily, with this special that we have with Taylor, we're giving you the opportunity to try it for a period of time before you make that decision. So you should know very quickly with your free month whether it's something you want to continue. And it does not auto-renew, which I know people are a fan of. I've heard the horror stories of, we wanted to cancel a program, but it just locked in for another year. Now we're stuck with it. So that's not going to be a problem. Once you've used us for the initial term, we go month to month and it stays that way forever. So yeah, really good question. And then like I mentioned before, there is the sliding scale on pricing based on the term length. So that's something that we can always work with you individually on.
All right.
Great question.
Well, if we don't have any more questions, Rob, thank you so much. You have given so much information, and I think it's going to be super helpful to a lot of practices. We have enjoyed you being on here. You have great chemistry.
Awesome. That's always good feedback to get. I can't thank you guys enough, Carla, Ashley, Dr. Krause, for having us. You know, the reputation of these Tuesday sessions precede you. So I really appreciate the opportunity to talk to you guys and everybody else who's been listening. Hopefully you have my information, whether you're a Demand Force user or you're ready to get started. I look forward to talking to you guys one-on-one.
Absolutely. Don't forget, everybody, you can go back and replay this if there's any questions you may have had that may have been answered in the beginning of it. And don't forget to join us next Taylor Tuesday, which is 2 weeks from today, for Equinus Management for Improved Patient Outcomes with Patrick DeHeer. And the lovely Ira Krause and Mike King will be back in your homes as usual. Everybody have a good night, and thanks for coming on and joining us.
Thank you.
Thanks so much.
Bye.